This is Dr. Corey Maas on Looking Your Best. Today we had a really great strategy session for best practices and best outcomes with laser hair removal, and out of it I really wanted to discuss a couple of the questions that many patients ask, and certainly it's a topic of interest and consideration for our nurses, and that's alternative technologies for removing hair. And it's like anything where there's a very big market of unwanted hair. Something like 80% of women have unwanted hair, and 50 or 60% of men have unwanted hair, namely on the back and shoulders and things like that. Whether they're going to actively do anything about it beyond shaving is another question. And I think the technology of laser hair removal has gotten so much better and so much more comfortable that many people are seeking a permanent solution, a very long-lasting solution to permanent hair reduction. So with that interest, it does bring up the question of, are there other things out there? I remember during my residency in surgery, in general surgery, and on head and neck surgery, I moonlighted for an electrolysis. So I'd work in the evenings because it was so painful. Electrolysis is basically taking a pen with a tiny little needle electrode on it that has energy current that's passed through it. It's generating heat. And that little needle is placed right along the hair shaft. The foot pedal is depressed and a very sharp jolt of heat is generated. And if it's placed absolutely correctly, that will damage the hair follicle just like the hair removal lasers do efficiently without penetrating the skin. Now, it's a tedious and very time-consuming procedure. You have to do each hair individually. So if you're imagining doing a whole back, this would have taken weeks or months. Electrolysis really don't even try to attempt that in one session. For small areas of hair, it's very effective. We still have an electrolysis device that we use, and it's typically in areas that are hard to access, particularly resistant hairs or white hairs, hairs that are white or gray or have very little pigment in them, and there's not a lot of them. Electrolysis is still a very effective method. It's just for very few hairs. And I think in today's world, hair removal has gotten to the point where it's pretty much made the electrolysis technique obsolete with those few caveats that I mentioned. There are other ways of doing hair removal. There's, if you can imagine the technology or torture that they're out there, there are certain devices that you can move up and down on the hair-bearing area that are designed to grab the hair and literally rip it out. I can tell you that it is extremely painful, much more painful than any kind of laser that you would do. Waxing is obviously very popular, and it's a way of shaping the hair. It brings to mind some of the recent movies that one might have seen where waxing was done on the chest area, and just the feeling of it. But many women do it and get through that. And I will tell any woman that's had waxing in the bikini area or other sensitive areas that laser hair removal is far more comfortable, and even if it takes multiple treatments, a far more effective and efficient result. Waxing, pulling the hair, plucking the hair on the body, and even on the face rarely results in permanent hair reduction. The one exception to that is around the brow, where one has to be very careful. And it's interesting, I've just treated a patient yesterday that had accidental hair loss around the brow where they treated the area with a certain type of laser, not intending to get the hair, and those hairs won't come back. And I've also seen similar types of things which were very common 15, 20 years ago, where older women would wax the entire brow and then sort of pencil it in to reposition the brow surgically. Unfortunately for them, even with one waxing, many of them don't get full or complete hair restoration. The hair doesn't come back. There's strategies we can do to help with that, including transplanting hairs if they're lost from this area. But the main thing is the brows are sacrosanct. I would advise everyone to be very cautious and judicious in waxing or plucking the brow because those hairs don't always grow back. With that said, it's certainly not efficient in shaping the brow, and we rarely do brow shaping with laser hair removal. This is usually for larger areas, and certainly areas of unwanted hair. I've done it in the area of the temple. We have done brows in certain circumstances where they're very thick, but I think for most patients, the technique of plucking, that's the one area where it's an efficient and effective way of managing unwanted facial hair. So if you have any questions about these other techniques or technologies or how they compare to laser, or even want to experience laser hair removal. It's a very inexpensive and very effective and comfortable way of getting rid of a very common problem of unwanted hair on the body and face. If you have any further questions about laser hair removal, please don't hesitate to write me, send me photos, videos if you wish, and I'm happy to respond at drmaas.com. You can visit my website at maasclinic.com, and I always welcome those questions and answers, just like we're doing today. As always, it's my pleasure to help keep you looking your best. This is Dr. Corey Maas.